Good morning, everyone. My name is Ann Spinard, and we are going to address Section C, cognitive. If I can get these two. Okay, great. I think I was hold on a minute, we're getting there. All right, so we're going to talk about Section C, cognitive patterns. And so just in getting ready to do this section, I wanted to just talk about some of the things that you have in your packet here. And if you're live streaming, that you can gather from the IRF packet. It's from the CMS site. There's a folder labeled IRF Packet August 2016. And so if you're at live streaming, you want to go into this file folder, and if you can pull a couple of documents from that folder in preparation for my session. And then for those sitting in the room today, in your folder on the right-hand side, you will see a form that says quality indicators, admission, cognitive patterns. This exact document, again, is in the folder on the CMS website. And then also in that same folder and on the right-hand side in your folder here will be your BIMS role play scripts. Just pull them out. You won't need them right now, but just have them available. As we go on, I'm going to review how to complete the BIMS, and then instead of doing a video that we did the last time we're training, we're actually going to, Karen and I are actually going to demonstrate how to do the BIMS. And so what I will ask you at that point, I'll remind you, is to pull out one of your scoring sheets, and we're going to do the interview, and you should score along, and then we're going to review the scoring, and then you're going to have the opportunity to practice yourself. So that should give everyone plenty of time to gather the information that they need. So what are the objectives for what we're doing today? Well, we're going to illustrate a working knowledge of Section C, the cognitive patterns. You're going to be able to articulate the intent of Section C, demonstrate the application of the BIMS with a partner, so we're actually going to do the practice. And with this interview, it's really important to practice it and make sure that staff are comfortable with the interview items and about the opportunity to pause and let people respond. We're going to interpret the coding options, and then we're going to apply the coding instructions in order to accurately code the practice scenarios and make sure that we know exactly how to code this area. All right. So all items in Section C are new to you. So we have C0100, and that's the kind of what we call a gateway question. So should the brief interview and mental status be conducted? And we're going to go through these in detail. Then we have C0200 through 500. And that's the brief interview for the mental status. That's actually the BIMS. And then C0600, should the staff assessment for mental status be conducted? And then, so that's saying they either failed or were unable to complete the brief interview, so now you have to do the staff assessment. And then C0900 is actually the staff assessment, or memory and recall ability. The Section C is assessed on admission, and we are going to use this to help to determine the patient's attention, orientation, ability to register and recall new information. And if you think about that, that's really important when you're going through and all of your care planning and how you're actually going to care for your patients. So if you know that they can recall, but that takes them a little bit of time to recall, you'd want to make sure every staff member knows that, so we're not rushing that patient through, and we're allowing them the time that they need to process information and get us the answer. Okay, accuracy and reliability. It is a structured cognitive test. It's more accurate and reliable than an observation, so I'm asking questions. I'm asking my patient to recall. I'm getting a real sense about their ability to process information and to store that information and recall that back versus your assessment. It's what you think or what you can observe. Now, we do the staff assessment if and when the patient can't complete the BIMS. But I guess the one take-home message with the BIMS is please, please, please try the BIMS on everyone. Don't assume that they can't do it. It's been amazing, even people with some cognitive difficulties and whatnot will surprise you in their ability to complete the BIMS. It prevents mislabeling based on appearance or assumed diagnosis, and it provides insight into the patient's current conditions and will enhance good care, and it, again, helps you identify if someone needs additional supports to be able to be successful. So now we're actually going to go into some of the items. C0100 is should the brief interview for mental status or the BIMS be conducted? So here we have it, C0100 identifies if the interview will be attempted. The BIMS is a structured cognitive interview, which we said. And again, we reiterate that most patients are able to attempt the interview. So here you're going to be coding, it's a yes/no answer. Should the brief interview for mental status be conducted? And an attempt to conduct the interview with all patients. So you're going to say yes, I'm going to hopefully determine that. If you're deciding that maybe, how do I decide, am I going to do the interview or not? Determine if the patient is rarely or never understood verbally or in writing. If rarely or never understood, you're going to skip through this and go to C0900, and you're going to do the staff assessment. So you have to make this determination. Again, don't jump right to the staff assessment. So be very thoughtful. Work with your team and everyone who's starting to assess this patient and say, can we or can we not do the assessment? Code whether the cognitive interview should be attempted. So I already said this, it's a yes/no. No if the interview should not be attempted because the patient is rarely or never understood, they can't respond verbally or in writing, or an interpreter is needed but not available. So that's not an easy out. We really want, if the person needs an interpreter, you should make every effort to make that interpreter available within that 3-day period of time in the assessment window so that you can complete the BIMS instead of having to go to this staff assessment. But if they're not able to respond to you verbally or in writing, it's going to be virtually impossible for you to be able to complete the assessment. If you should attempt the assessment because the patient is at least sometimes understood verbally or in writing, or if an interpreter is needed and you have one available, then you want to complete that assessment. And so we already talked about that. If you need an interpreter and it's not available, you code 0, it wasn't attempted, and then complete 0900. Include patients who use American Sign Language as part of this whole process as needing an interpreter. I think most organizations at this point, having interpreters or some sort of interpreter service is something that's part of our normal course of business. So it might be about making sure that you can schedule this and you have the time to do it. So let's go into the brief interview for mental status, and these are questions C0200 through C0500. So the reason for doing these item rationale, we've kind of talked already about this. The chance of hopefully this will reduce the chance of incorrectly labeling the cognitive ability. It improves detection of delirium. It gives you a sense about the patient's ability to recall. Hopefully it will dissuade from misdiagnosis that may result in appropriate communication techniques, worthwhile activities and therapies not being offered. So if we make an assumption that they can't communicate and we jump right to the staff assessment, and we don't really have a sense, we may say, well, they can't engage in this, they can't do this, they can't do that. And again, we're making some assumptions without trying to do the assessment. Awareness of possible impairment may be important for maintaining a safe environment and providing safe discharge planning. So this would be important for all your staff to understand how this person communicates. Then how do you communicate that information to your staff so that they understand the best way? Is it in writing? Is it with cue cards? What is it? So that they can have a worthwhile, interactive ability to communicate with your patients. Cognitive intact patients may appear to be cognitively impaired because of extreme frailty. Hearing impairment. Hearing impairment is probably the biggest one. So please, 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 just because someone has a hearing aid, is the battery working? Do they have the hearing aids in the right ear? It's amazing, right? I mean, has anyone ever seen this with hearing aids? Batteries are dead. Hearing aids are in the wrong ear. Sometimes hearing aids have these little tubes that need to be cleaned out. So you want to make sure that the hearing aid is working, functioning. Then you want to make sure that you're in a quiet environment. We recently were out for another project testing some new measures, and they were interviewing a staff member, and we were in a quiet conference room, or not a staff member, I'm sorry, a patient, and we were in a quiet conference room where all of a sudden they started weed whacking outside the window. And it was really hard. I was sitting on the other side of the table and down a little bit. I really struggled because the patient was a little low in what he was saying, but he was lucky because the staff member was close enough to him that he could hear the staff member. But I was struggling to hear him with all the background noise. So make sure that the environment is quiet. And then certainly lack of social interaction, so the person just having the ability to interact, to engage, and whatnot. And then, of course, you have some patients who may appear cognitively intact, and they act then more so than they actually are. Those are the ones, they're great. You go in, you say, hello, how are you? And they're like, oh, I'm great. I love your sweater, blah, blah, blah. And then you scratch the surface, and you realize, oh, we have some cognitive issues with this person. But the BIMS will help you to get there, and that's okay. So that would be important to communicate with all staff. She's got amazing social graces. She appears that she's cognitively intact, but she's going to need a little bit more guidance. So that's an important fact that we will be able to pull from the BIMS. And it provides you that, again, that direct understanding of the patient's function and can enhance future communication and help all direct caregivers with interventions to facilitate greater independence, which is ultimately what we want, right? We want our patients to be as independent as possible and hopefully to be discharged out into their home environment or whatever environment that they need to go back into, and with the appropriate amount of assistance based on accurate assessments. All right, so now let's get into the meat of the BIMS. So the structure of the BIMS, in C0200, we're going to be asking our patients to the immediate repetition of 3 words. And then in C0300, we're going to get them some questions around temporal orientation. And then C0400 is a recall question. And then we compile all those together, and then we get a score. And we're going to actually go through this. So the basic interview instructions, and these are going to be important. So they're important for you to understand them today, and they're important when you go back to your facilities, or for those of you in live streaming, think about these things. How am I going to be confident that my staff understand all of the components of the BIMS, and in fact, how to administer the BIMS so that I get accurate information on the back end? And one way of doing this, as you'll see as we go forward, is actually practicing this. We're going to give you some sample scenarios that you're going to work with, but you can come up with your own scenarios. You can have fun with this. You can do role playing. You can really make this an event that people can laugh about and enjoy, but I think what they will do is pretty quickly understand how to get the information out. All right, so interview any patient not screened out by C0100, and so that's important. Conduct the interview in a private setting. I talked about that. So think about that alone. Are most of your rooms semi-private? If they're semi-private and there's no one else in the room and you can close the door and it's quiet, great. But think about things like radio, TV, background noise, stuff going on in the hallway, whatever. Can you bring the person into a private conference room area where it might be down the end of the hall and a little quieter? What we want to try to do is make sure the environment is the best environment for the person. Make sure they can hear. Sit so that the patient can see your face. So it's really important, right? Engage, connect, eye contact with the person. Give an introduction before starting the interview, and we're actually going to demonstrate that here. You can do whatever couple of lines that you want to do, but you certainly want to make sure that that once you sit the person down, that you make sure that it's an okay time to do the interview, introducing yourself, introducing what you're going to talk about today. Make sure that they can hear you, that they are comfortable, that they don't need to go to the bathroom, that they're not in pain. Think about that, right? If you're sitting there going, gotta go, and they're not going to be focused on what you're having to say. So just make sure that you're setting up the best environment that you can for that person. If the patient expresses concerns, he or she may be more comfortable if you reply, "We ask these questions of everyone so we can make sure that our care will meet your needs." They want to make sure that you're not, like, this isn't a test, that you're not saying, "Oh, I'm, making the person feel silly or not smart or whatever." Just make this very casual. We do this as part of our assessment, just like therapy does their assessment and whatnot. This is all part of it. In some IRFs, we're hearing speech therapy is going to do this as part of their basic assessment. Okay, well then that will be just part of what they're doing, and so we just don't want to make a big deal of it. It doesn't have to be speech therapy. It could be nursing. It could be anyone that you determine in your organization. Please conduct the interview in one sitting in the order provided. So it's really important to follow the script, to use the exact words. So some of the questions people have is, and I'm going to go through the words in some of the recall questions, and they'll say, can we use different words? Can we do a variety of different things? It's really not. It's been tested, so think of it as a valid and reliable tool, so you need to administer it in the way that it has been tested to do. If a patient chooses not to answer a particular item, accept his or her refusal and move on to the next question. But please be patient. It takes some people some time to process the information. So allow them, don't rush, allow them the opportunity to process the information and give you an answer. And not to rush them through. Stop the interview if necessary. So if you're, unable to, or you're seeing the person getting distressed or just they can't complete it, it's okay. Just stop the interview. Stop the interview after completing C0300C day of the week if, and then, so this is part of the instructions, okay? If all responses were nonsensical, so every time you asked a question or asked them to recall, they just were in a whole nother world. They were saying words, but they had nothing to do with what you just asked them. Totally unrelated. There was no connection about that. Or they're putting out sounds that are not real words, okay? No verbal or written response to any of the questions up to this point. So you're getting nothing back from that person for whatever reason. And no verbal or written response to some questions and nonsensical responses to other questions. And we're going to go through some examples of this so that you get a sense, again, how to go back and then work with your own staff. If the interview is stopped, do the following. Code a dash at C0400A, B, and C. And I will say right now, these dashes will not count against you for any of the quality or payment issues. And I think that was clarified or is being clarified in the newest manual that was put out around that. Code 99 in the summary score, and then code yes at C0600 should the staff assessment. So what you're saying is they failed to be able to answer the BIMS, so now I tried it. They weren't able to complete the BIMS. I code it as a 99, and then I say at this point, now I must complete the staff assessment because I was unable, or the patient was unable to complete the BIMS. And then we move on and we do the staff assessment. If the patient's primary method of communication with you is in the written format, the BIMS can be administered in writing. But the BIMS administered in a written format should really be limited to someone who really that's the only way that they're able to communicate with you. So we don't want to just say, oh, it's just easier to do this. We should really try to have the person verbally communicate to us or through an interpreter, and then use writing if that's the only way that they can communicate. So let's talk about this idea of this nonsensical response, and it should be coded as a 0. So let's go through a definition. Nonsensical response is any response that is unrelated, incomprehensible, or incoherent. It is non-informative with respect to the item being rated. And we're going to actually go through some examples today on something that might be considered nonsensical. So if the interview asks the patient to state the year, so what year is it? And the patient replies, well, it's 1935 and it was a great year. And so when we think about that, well, that's wrong, right? That's not correct. But it's related to the question. So they at least understood that we were asking about a year. It's an incorrect answer, but it's not nonsensical. So you would code the answer as 0 incorrect, but would not be considered nonsensical. All right. So let's say you ask the patient, please state what year it is right now. And the patient says, oh, what difference does a year make when you're as old as I am? The interviewer asks the patient to try to name the year, and the patient shrugs. You code the answer as 0 incorrect, but would not consider it nonsensical. The answer is wrong because the refusal is considered a wrong answer, but the patient's comment is logical and clearly relates to the question. So they were able to kind of comprehend that we were talking about a year, and year related, they related to age. And so they were able to, we would code that as a 0. In another one, the interviewer asked the patient to name the day of the week, and the patient answers, Sylvia, she's my daughter. Can you see where it's so important? You got to make sure they hear what you're asking. The other thing that I didn't get into, but when some of these questions, especially with words and whatnot, the interviewer should be very clear in their speech pattern. Clear, articulate, and think about people who might have a very strong accent that may make it difficult for someone to hear. My mother-in-law had severe hearing loss and had hearing aids, and we had an occupational therapist coming into our home to work with her who was lovely, from Ireland. And her brogue was such that my mother-in-law, with her hearing aids and her hearing loss, couldn't follow directions. So we ended up, she was lovely, but she was ineffective. I know it's a little different but think about that. So think about if there's any kind of an accent or whatnot. Is it that the person's not hearing because of the accent and struggling to understand, or is it that they truly are just not able to process? So make sure you take all of that stuff into consideration. All right, so C0200, repetition of 3 words. So these are the 3 words. You will learn these 3 words. Ask the patient to repeat 3 words. And these 3 words are the 3 words you need to use. You can't use other words. Sock, blue, and bed. Now, the last time I taught this, people thought I should wear blue socks. I didn't. I'm sorry, I wore gray socks. I wasn't even thinking. And I probably should have worn a blue shirt or something. But anyway, so sock, blue, and bed. The inability to repeat the 3 words at first attempt may indicate that there's a memory impairment, a hearing impairment, they didn't hear you, a language barrier, again, maybe they didn't understand the words, or inattention that may be a sign of delirium. So we need to start figuring it out. What is it that is going on with this particular person? That's the reason it's helpful once you get them into a setting to give them a couple of very, simple instructions so you can ensure that they're able to understand what you're saying and hear you. So when we go through and we do the assessment, again, making sure that you're educating your staff, ask the questions exactly as written, immediately prompt for a response. This is one where you're going to give the 3 words and ask the person to give you the answer right back. If the patient repeats all 3 words correctly on the first attempt, that's great, but then you want to reinforce recall by repeating the words with a categorical clue. This is an important piece. So I'm going to ask you to repeat 3 words. Sock, blue, bed, and you respond back to me, sock, blue, bed. Then I need to say back to you, great, thank you. Sock, a piece of clothing, blue, a color, bed, a piece of furniture. I'm giving you a categorical clue, even though you got them correct. And I'm doing that because then I'm going to be asking you a couple of minutes later to recall them. And if you can't recall the words without clues, I'm going to give you back those same clues so that you'll remember the words. All right. If the patient recalls 2 or fewer words in the first attempt, make a second attempt using the categorical clues, prompting using the cues. If the patient does not recall all words on the second attempt, make a third attempt, and then repeat the words and use a clue. And the idea here is we're trying to get them to really remember the words. A phrase that puts the words in context helps to promote the patient's recall ability, stimulates learning. And then the clues here, I already said these: for socks, something to wear; blue, a color; and bed, a piece of furniture. And you can do that reminding both verbally, or you can do it in writing. If the patient does not repeat all 3 words after 3 attempts, reassess the ability to hear. So this may be a real opportunity. Are they hearing you at all? And if they are, okay, that's great, then continue to move on. And then if they're unable to hear and you realize, oh, this is really a hearing issue, fix the hearing issue and then do the assessment. Words can be recalled in any order or in any context. So they don't need to give them back to you in the exact order that you gave them, but they do need to be those words. They can also give it back to you in a sentence, and that's okay, but they can't give you a laundry list, like, of every color, every piece of clothing, every piece of furniture they can think of. That's not what we're looking for, but they can certainly give it back to you in a sentence. And then score the number of words repeated on the first attempt only. We already talked about this. If a staff member can't say the words clearly, move on, get someone else. If the BIMS may be conducted in writing, we already talked about that, but using it in limited opportunities. And then you can look at the IRF-PI manual for further details and helping you through this process. So here's the actual scoring. Record the maximum number of words that the patient correctly repeated on the first attempt only. So you give them the 3 words, and you're asking them to immediately recall. So were they able to recall 3 words? You score them a 3. 2 words, you score them a 2. If they got 1 word correctly, you score them a 1. If they got none of them correct the first time, then you score them 0. You're going to go on and reinforce, but you're scoring at the first attempt. So again, when you're working and educating and training with your staff, some people may want to say, well, let me give them 2 or 3 tries and then score them. No, this is the first time, all right, for this particular assessment. Okay, so the words we said there: sock, blue, and bed. Now please tell me the 3 words. And the patient says bed, sock, and blue. That's right, the words are a sock, something to wear; blue, a color; and bed, a piece of furniture. So you're giving them categorical clue. All right, I think we have our first coding question. So is this a scoring one? Okay, so on your tables, there are little devices, they look like little calculators, little white devices. Okay, so what I want you to do is, based off of the example that we just gave, how would you code C0200? So you would ask them to repeat. I'm going to just repeat this. The words are sock, blue, and bed. Now please tell me the 3 words. And then the patient responds, bed, sock, and blue. So would you code 0, none, B, code 1, C, code 2, or D, code 3? If you can go ahead and put those in. Everyone got there? This is your first. You'll be having these throughout, so using your little devices. There's only 2 at a table, so not everyone gets, so you have consensus at your table. All right, so 74% of you got this correct, which was D, 3 words. So I had asked the person to say sock, blue, or bed, and they reported back to me bed, sock, and blue. So they got all 3 words the very first time that I asked them to repeat them. So 3% said that you got none of them right. Then we had a couple people who said 9% that said B was correct, that they had 1 correct. 14% of you said 2 were correct. I think some people were probably just grabbing and just learning how to use the devices. But if for some reason we ask another coding question and you hit the wrong button, you're like, oh, darn it, I hit the wrong button. Go ahead and hit the right button. It will recalculate it for you, all right? Just so you can practice with the tools. All right. So we talked about that. Then we would code in a 3 for this particular scenario. All right, we're going to do another practice scenario here. So keep your coding devices. The words are sock, blue, and bed. Now please tell me the 3 words. And the patient responds, sock, bed, black. Then as the interviewer repeats 3 words plus the categorical clues, let me say the 3 words again. They are sock, something you wear, blue, a color, and bed, a piece of furniture. Now tell me the 3 words. Oh, yes, that's right. Sock, blue, bed. So how are we going to code this? Take your devices. People coding? Okay. Everyone ready? All right. Most of you, we got this. The answer is C, 2. And why is that? That is because they said the color black the first time around. They got it right the second time, right? After you gave the categorical clues. But the first time they said sock and bed, which were correct. But instead of the color blue, they said black. So they got 2 of the 3 words correct the first time out. And so then we would code a 2 there with the first attempt. All right. The words are sock, blue, and bed. Now please tell me the 3 words. And the patient responds back to you, blue socks belong in the dresser. And then please repeat the 3 words plus the categorical clues. So I'm not going to read it all to you, but we'd again go through the categorical clues with the patient. So again, the patient responds, blue socks belong in the dresser. So how are we going to code that one? Okay, ready? All right, so this one people struggle with a little bit more. Okay, so the answer here is 2. So the issue here is the 3 words are sock, blue, and bed, and they responded to you blue socks, so they have blue and socks are correct, right? Belong in the, and they had dresser versus bed. So remember the words yourself. So as you see, as they answered it in a sentence, that was perfectly fine. That's not the issue. The issue is they said, if they had said blue socks belong on the bed, then we would have had the 3 words, right? So the dresser was the issue here. So just make sure, so we have some, even just here in this room, we have some people having difficulty in coding this. So this is an area, again, where it just takes some practice. And it takes you paying attention. You can't be distracted either when you're listening to the response of your patient. All right. And then you go ahead and code a 2 in the coding scenario. All right, so let's move on, and then we actually will do some practice. So temporal orientation, year, month, and day. So this is the next set of questions that we're going to ask. In general, the ability to place oneself in a correct time. For the BIMS, it's the ability to indicate the correct date in current surroundings. So we're gonna ask each one of the questions one at a time. And we're gonna ask C0300A, which is the current year, 300B, which is the month, and 300C, which is the day of the week. Allow up to 30 seconds for a response. So they're gonna have to think a little bit harder here. So give the person enough time to think, process, and then communicate out to you. Do not provide clues. If a patient specifically asks for clues, tell them that you need to know if they can answer without any assistance. But I will tell you, it's okay if the person starts looking around in their environment to help them for clues. You're not going to point things out to them, but it's okay. You're not going to say, keep your eyes on me. You can't look around. That's not what this is about. So if they're looking around their environment to help them to recall, that's okay. Assess the ability to report the correct year, and code 0 if the patient doesn't answer. Code 2 if missed by 1 year. If the patient answers an incorrect or is within 1 year of the current year. Code 1 if they miss between 2 and 5 years. This where it may be helpful as we go through some of these questions if you have your BIM scoring sheet out, so that you're not having to remember what I'm saying, so you have the scoring sheet that tells you that. And then code 0 for missed by greater than 5 years or if they don't answer. All right. So the date of the interview is April 1st, 2016. So you've asked the patient, what is the year? And the patient responds 16. And then the interviewer says, can you tell me the full year? And the patient responds 16. And the interviewer again asks, can you tell me the full year, for example, 1982? And then the patient says, 2016. So you just help them to understand we wanted the full 4 digits of the year. So in this scenario, how would you code this question? So take your little coding devices. And again, it might be helpful for you, both streaming video and here, to look at your BIMS coding sheet to help you. Again, the interview is April 1st, 2016, and the patient originally said 16. You asked them to give you the full year. They said 16. Can you tell me the full year, for example, 1982? And then the patient says 2016. All right. Everyone ready? All right, great. Everyone, we've got the majority of people got that. Code 3 as correct. So they actually got it correct. We don't give points off for having to give them a little bit of a clue here to be able to give you the correct answer. I mean, 16 was the correct answer, but we really wanted the full year, 2016, so that they didn't mean 1916, but okay. All right, so the code here would be code as 3, correct. So now let's talk about the month. And I think this is the one, believe it or not, where staff struggle the most with. So it assesses the ability to report the correct month, count the current days as day 1. So if you look at, again, if you pull out your coding sheet, when we're looking at the month, we're asking what month are we in right now? And then to code the answer, you want to say it's accurate within 5 days, which would be code 2, missed by 6 days to 1 month, or 0 missed more than 1 month, or no answer. So it's going to be important to understand that, especially if you're on a cusp of a month, right? So that matters. So write the patient's response in the margin and go back later to count the days if you're unsure whether the date given is within 5 days. So I think we have some examples here. All right. The date of the interview is June 2nd, 2016. And the patient states that it is May. So you've asked them what month it is. It's June 2nd today, okay? Let's pretend, not August 8th, but it's June 2nd. And the patient says to you it's May. So now you're coding. So how are you going to code this? Use your little clickers. Take out your BIMS form, which may help you. And so how are you going to code this? We have people coding? Okay. All right. Code 2, accurate within 5 days. And that is correct. So it's important to know that if it's June 2nd, we're 2 days into June, right, when we're doing the interview. so that if they said May, it's within that 5-day window. So some of the questions that have come up, some of the frequently asked questions were, well, how do I know what month? So you have to just know, well, if it's, 28 days in February and you're into the 3rd of March, you know what I mean? You have to figure out how many days. So you have to reorient yourself first and then calculate how the patient did. Just that's the reason it's sometimes easier than getting yourself all distracted. Just write down whatever they said and then go back in and say, well, today is whatever date. And so if someone today said it was July and this is August 8th, how do we code that one? We would say code 1 missed by 6 days to 1 month, right? Because today is August 8th. So just that's literally the level of it. So think about your staff. How do you clearly articulate this particular question to your staff? Make sure that your staff understand it, practice it, so that they're able to accurately code the question. All right, so here they give you the math. June 2nd minus 5 days is May 29th. So in fact, the patient answering May is fine. Okay. Okay, so then we have the day of the week. So the ability to code the day of the week. Let's see here. All right. So the date of the interview. So let me go back here. All right. So assess the patient's ability to report the correct day of the week. And this is either you're correct or you're not correct. So there's no like within 5 days, within 1 year, whatever. You either know the day of the week or you don't. Now, I'd be hard-pressed some days for people to ask me what day of the week it is. I'd have to think. But that being said, we're asking the patient. So it's either correct and you score 1, or incorrect or no answer, you code 0. So here's an example. Take out your devices. Date of the interview is Monday, June 27th, 2016, and the patient states it's Tuesday. So we're going to code this as correct, A, for this particular coding scenario, or B, 0, incorrect. This is a relatively easy one. And so everyone got this correct. Congratulations. Give yourselves a hand. Very good. This is probably one you don't need to do a whole lot of training on, but make sure the person is oriented themselves, especially, if you're working weekends and stuff like that. You sometimes get mixed up and say, what day am I today? Or if you've had a holiday, if it's a holiday week and stuff and you've missed a day, you may be thinking it's Monday and it's really Tuesday. All right. So the patient was incorrect, stating the day of the week, so and it's a 0. All right, so C0 400 recall. Now we're going back. So now we've asked the 3 words, immediate recall. Then we go into these temporal orientation questions. Now we're going to ask that patient to recall those 3 words. So ask the patient to repeat the words from the earlier questions. And again, read the question as appears on the IRF-PI. Allow up to 5 seconds for spontaneous recall of each word. And then provide categorical clues for any words not correctly recalled after 5 seconds. Use category clues only after the patient is unable to recall 1 or more of the words. And allow up to 5 seconds after the category clues for the recall. Again, so if you're questioning, how do I do this? Pull your form out. It gives you some instructions. Just remind you how to ask these questions. Each word is coded separately. So here we're asking now to have them recall these words separately, and then you're going to code them separately. And then recall without cueing, patient names the item on the first attempt. They may list the items in the same category, and the interviewer doesn't provide cues. And then we have the recall after cueing. The interviewer must give cues, and the patient says the item in a list and or other items, and that's correct. So when you're coding these items, so this is 400A, B, and C, because we're asking these questions separately, you either code them as 2, yes, no clue required, they're able to recall it. Code 1, yes, after queuing, so then you had to give them a cue, and they were like, oh, yeah, that was blue. Or code 0, no, could not recall. Can't recall the words even after queuing, responds with a nonsensical answer, or chooses not to give you an answer. All right. So if on the first try the patient names multiple items in a category, one of which is correct, they should be coded as correct for that item. And the interviewer gives the patient a cue for an item, and they name multiple items in the category, code as could not recall, even if the correct item was in the list. So we're going to give you some examples of these. So coding scenario, we've asked them for C0400. We're saying, let's go back to the first questions. What are those 3 words that I asked you to repeat? And the page, so remember back, okay, what are the 3 words that we talked about earlier? And the patient says socks, shoes, and bed. The interviewer says to the person, one word was a color. And the patient says, oh, the shoes were blue. So how would we code? So let's say this was a real scenario. How are we going to code this section? All right. So for the recall of socks, how are we going to answer this particular question? Oh, this actually came up as one slide. Okay. So if we think about this, and I'm going to read these again, the patient responded, socks, shoes, and bed. So for socks, they answered it correct, right? They got it first respond. For blue, they didn't get the blue right off, right? You had to give them a clue. One of them is a color, and then they were able to say, oh, the blue shoes. So we give 1. Yes, they were able to answer it, but only after we gave them a clue. And then for bed, did they get bed? Yes, that came out because they said socks, shoes, and bed in the very first answer. So we would code recalls bed to yes. Does everyone get how that was done? Okay. And then this just goes through and gives us the rationale, and I already did that with you. All right, so this is a practice coding scenario. So this is one where I'm going to ask you to use your little clickers. So the patient is at, so again, have your, for you, streaming video and here. Sometimes it's just helpful to have your coding sheet here. So the patient is asked to recall 3 words, and the patient says, I don't remember. And the interviewer says, one word was something to wear. And the patient says, well, clothes. Okay. One word was a color. The patient says, oh yeah, blue. That's, I like blue. And the interviewer says, okay, the last word was a piece of furniture. The person looks around and they go, couch. All right, so that's how they've answered your questions. So using your clickers, how would you code C0400A through C? These are a little more complex. Hopefully you can read them up there. A would be all terms is coded as 0. No, could not recall because the patient's initials stated she could not remember. Or B, all items are coded 1, yes, after queuing because the patient required queuing to attempt a recall of all the items. Or C, all terms are coded as 1, yes, after queuing because the patient remembered at least one term after queuing. And then D, code sock and bed as 0. No, could not recall, and code blue as 1, yes, after queuing. So a little complex here. So look at your coding sheets and code these answers. All set? Okay. Here's a smart group here. Great. Okay, coded D. And because they weren't able to recall the sock and the bed, but they were able to recall blue after they were given a clue. So great job. All right, and this is again how we code that. All right, so now let's talk about the BIM summary score. We're kind of clicking right along here. C0500, and you will see that again on your coding sheet. And we already kind of went through the rationale: decreases the chance of incorrect labeling, of cognitive ability, improves detection potentially of some delirium, provides staff with more reliable estimate of patient function, and allows staff interaction with patients that are based on the patient's ability. So it's an objective assessment of how the patient is doing. So after completing C0200 and through C0400, we were going to add up all the values for all BIMS questions. And the lowest possible summary score is 0. And the maximum possible summary score is 15. So even though a patient scored a 0, it's still a valid BIMS assessment. That's an important piece to make sure your staff understand. All right? So 0 is valid. It's an okay assessment score to have. Try not to add up the total score while you're interviewing the patient. Focus your full attention on the interview. Apply the guidelines for determining if the interview is complete or incomplete. And then total scores reflect cognitive status. Between 13 to 15, basically cognitively intact. So this will be interesting to do on your staff, okay? Figure out their cognitive abilities. 08 to 12, moderate impairment, and 00 to 07, severe impairment. These are guidelines to help you then in planning your care and managing your patient. So it can be very helpful. Make sure you code the total score as 2-digit number. That's the reason there's 2 boxes. Include a leading 0 if the score is less than 10. And the scores, again, will range from 00 to 15. And then code 99 if unable to complete the interview. So if the patient refused, gave you the nonsensical items or whatnot, or you had to dash items, then you're going to have to go through and code that as a 99. And that is an indicator that then you need to go ahead and complete the staff assessment versus the 00. The 00 is the patient stayed with you, they engaged with you, they did the assessment, they just didn't have correct answers. 99 then says they didn't complete the BIMS, and now we have to do the staff assessment. All right. Occasionally, a patient can communicate but chooses not to participate in the BIMS and therefore does not attempt any of the items in the section. So this point that I want to make here is if you're going in to do the BIMS assessment and they won't engage with you because they're writhing in pain, what do you think you should do? I would think we should probably assess and medicate and then maybe reapproach that patient. But there are some people who just, you know what, they're so angry that whatever happened to them, and they're not going to engage with you or whatever. Or there may be a particular staff member that they don't like and they don't want to engage with that person. Although this is in the first 3 days, so usually they probably haven't determined those preferences of who they're going to like and not like. But you certainly want to make sure that you've done everything you can to try to get the BIMS done. This would be considered an incomplete interview. If the patient absolutely refused, you'd code a 99 and then go on to for C0500 and then go on and do the staff assessment. So we're going to do some simple math. So we are going to, so let's assume that we had completed the BIMS assessment, and these are your scores, and now we're going to score C0500. So everyone have your math done? I'm watching people count, because then you're going to actually give a scoring on your device. Okay, we ready? All right. What's the BIMS summary score? Everyone got it? Everyone did great. One or two people struggled a little bit there. But the summary score was 12 baseline. It's just simple math, okay? Just make sure that you're adding correctly. So what you would encode on the form is 1, 2. They had a 12. Let's say they had only scored a 2. It would be 0, 2. Always do the leading 0. All right. Okay. So this is an important piece. This is a completion guide. Just make sure you educate your staff on this and make sure they understand when they need to stop the interview and then move on to the staff assessment. For the BIMS to be completed, the patient has to attempt answering at least 4 of the items in C0200 through C0400. The answers have to be relevant. To be relevant, as a response only has to be related to the question. Remember, logical versus nonsensical, where they had nothing, you're asking them, something about the month, and they're talking about, Charlie Chaplin and whatever. It has nothing to do with what you're asking. The responses do not have to be correct. That's not what we're asking here. But they have to be at least related to, their response need to be somehow related to the question that you've asked them. And a score of 0 does not mean that the BIMS is incomplete. By the time you leave here, I think you will have had that point drilled into your heads. What constitutes an incomplete interview? Again, the patient who can communicate but absolutely refuses to engage with you and complete the BIMS. The patient gives nonsensical responses to C0200 through C0400. An incorrect but relevant answer is not nonsensical. Response or no answer. All right. C0200, 300 with all patients attempting the interview. Stop the interview after completing C0300C, day of the week, if, this is where you're going to stop the interview, all responses are nonsensical, or no verbal or written responses for any of the questions, so they've just not engaged with you at all, or no verbal or written responses to some questions and nonsensical responses to other. So these are the, either one of these or any of these situations then would say, okay, we're going to stop the interview and we're going to go and do the staff assessment. If the interview is finished, attempt C0400 but incomplete, code any relevant responses as appropriate, code all nonsensical responses as no answers or a 0, code C0500 as a summary score of 99. Remember, once you have that 99, now we're going to go to do the staff assessment. All right, if I could have Karen come on up. We're just going to spend a couple of minutes, and we are actually going to demonstrate an interview. And at this time, what I would like for folks here to pull out will be out of your packets the brief interview for mental status role plays. Just have those out and available. Also, and this is for live folks in live streaming, get this available because we're actually going to, after we do a demo, we're going to have you do some practice of this. At the same time, I think there's multiple copies of the admission Section C cognitive patterns or the BIMS interview document. Take that out also. For those of you live streaming, pull a teammate in. Anyone who's sitting near you, it doesn't matter. And you can interview the person, and we'll give you the instructions for that. Okay, so we are going to go ahead and do the live demo. All right. So, good morning, Karen. How are you today?
I'm good. How are you?
Good. Do you remember me? I'm Ann, the nurse.
Yeah, I think I see you around here.
Yeah. I'm working on the unit here. So, is it a good time right now? I'd like to ask you a few questions.
Yeah, okay.
All right, great. Can you hear me okay?
Yes.
And you understand what I'm saying to you?
Yes.
Great. Okay. So I have a couple of questions and things that I'm going to ask you. So I'm going to say 3 words to you for you to remember. Please repeat the words after I have said all 3 of them to you.
Okay.
All right? Mm-hmm. So the words are sock, blue, and bed. Now, if you could tell me those 3 words.
Okay. You said sock. You said blue. And you said dresser.
Okay, great. Thank you. That's great. So, blue, and that's a color. Bed, that's a piece of furniture. and sock, something you wear.
Oh,
So that's great. I want you to remember those because we're going to talk about those words in a little bit from now, okay?
okay.
All right. So I have a couple more questions for you.
Oh, more
Yeah,
questions?
yeah. Okay. So I just a couple. Can you tell me what year it is right now?
This year?
Yeah.
2015?
Okay, great. Thank you. All right. So I have a couple more questions. What month is it right now?
Oh, this is July, because my daughter came to visit me and we had cake. It's her birthday.
Oh, that's great. That's great. Thank you. How about what day of the week is it right now?
That's a hard one because when you're here, you don't know what day it is. You know, like all the days seem the same. But I think it's Monday.
Great. Thank you so much. I really appreciate it. Now, I just have just a little bit longer and we'll be done. If we could, let's go back to the first questions that I asked. What were the 3 words I asked you to repeat?
I don't think I can remember those words. I can't remember.
Okay. All right. Let me help you out a little bit. How about something you wear?
Shirt?
Okay, great, great. How about a color?
Oh, I remember you said blue because that's my favorite.
Ah, that's great. Okay, good. How about a piece of furniture?
A bed?
Great, great. Very good, very good. Well, that's it for this interview, and I so appreciate your time. Thank you.
Oh, you're welcome. You can visit anytime.
Okay, great. Thank you very much. So, as you watch, I should have given you some instructions. I wanted you to encode your BIMs based on how we did, and then we're going to respond. But we'll actually go through that. Did some people record how we did? Okay, great. And you actually, when you're in your facility, your organizations and whatnot, this is actually a good way to do it. You could do it during a staff meeting, you could do it during team training, whatever it is. Actually show a live demo and then have people practice, which is what we're going to have you do. All right, so let's look at the scoring. So for C0200, repetition of 3 words. So I scored this as a 2. Did you guys agree? Right, okay, great. And I think she varied from our script a little bit and had said she had actually gotten socks, so then she changed the bed to a dresser. She was good that she remembered she needed to get 1 wrong, so she coded that as a 2. But anyway, okay. And then in the year, we coded it as a 2, because she said it was 2015, and of course we know it's 2016, so she missed it by 1 year. The month, and she said the month was July, okay, and so we coded that as 1, missed by 6 days to 1 month, right, because it's August 8th today. The day of the week, what day of the week is it? We scored it as a 0 because remember it's either correct or incorrect. And I think she said it was a Monday and today's a Tuesday. All right. And then we go into C0400, A, B, and C. And I asked her to repeat the 3 words, and she was able to come up with the bed, right, blue, but she missed socks. I think she said shirt instead of socks. All right? And then if we add these together, C0500, the BIM summary score would be 7. Everyone see how that was scored? Okay? So that's exactly how you have to complete this assessment. So what I'd like to do is take a couple of minutes, and again, if you're watching on stream video, if you can, I strongly encourage you to do this also. Pull someone into your area. Hopefully someone else is watching with you. Pull off the practice brief interview of mental status role play. There's a couple of scripts here, so pair up at your tables or group with other tables. One person can be the interviewer, the other can be the patient, and then you want to go ahead and score these, and we're going to review the scores. And there's a couple of scenarios, and the idea is to take you through the process. So, patients, there's some clue. If you're the patient, there's some clues in here on how difficult you can make this for your interviewer. Have some fun with it. It's a good opportunity, again, to practice. So we'll give you, I think, what do we say, about 5 minutes or so to practice these. So whatever you can get to, you can choose. There's 3 scripts in here, so choose. Hopefully you'll get through at least 2 scripts during the 5 minute. Doesn't take a whole lot of time to do these. So pull them out, pull out your scoring, and we are going to give you 5 minutes to complete these and practice these assessments. And the same for those of you in streaming video, if you can go ahead and do that. Okay, so these are the instructions. Read over your scripts, but don't share with your partner. Complete the assessments. Spend 10 minutes coding. I think time-wise, if we can do around 5, maybe 10 minutes, I'll see how the room is doing, and then we'll stop it. But try to complete it, then switch the roles so you get the opportunity to do both, and then be prepared to share your experience with us. So, okay, 1, 2, 3, go. So welcome, everyone, for live streaming. I'm sorry that you missed the Academy Award presentation that we had just a few minutes ago, but certainly it will be available on once the materials are all posted. All right, so we just to catch everyone up, we've been doing BIMS role play, and so people have been sitting at their tables and trying and practicing the BIMS, and those materials are, as just Mark had explained, you can download those from CMS. All right, in general, I walked around the room, people were engaged. Did we find value in the interviewing process and practicing? What are we sensing? I'm getting getting nods, yes. You can take these scenarios back to your organization. The previous IRF training, live training that we did 3 different scenarios. So now there's going to be, once these materials are posted, they are posted, there'll be 6 different scenarios that you can pull down and use for training and of your staff. Or you can make your own up and have fun on doing this. But this is the best way to ensure that your staff understand how to code this particular section and how to follow the directions. All right, so what I'd like to do is kind of go through each one of the scripts quickly, because we have a lot of material to still cover. But in script number 1, the person here, the patient didn't answer any of the questions correctly. Is that true? That's what happened in your group? They talked about everything under the sun, but answering your questions. So that was good. So they were unable, if you followed through this script, if you were doing it, all of these should have been coded as a 0. And we got a BIMS summary score of 0. And I was joking by saying they were talking about everything under the sun. That's not really true, because then that would have been nonsensical. They just weren't able to accurately engage and give you the accurate information. So with having a summary score of 0, is this a valid and complete BIMS assessment? Yes, and that's correct. I'm seeing a lot of people shaking their heads yes, and hopefully that's exactly what we're seeing. People who are observing this on streaming video, that in fact that this would be a valid assessment. All right, in script number 2, in this particular script, the patient answered many of the questions correctly. But got a couple that were incorrect. So they were able to do 3 words, the year, the month. They didn't get the day correct, and then they were able to recall the first time when we went to C0400, a sock blew in bed without any cueing, so they got the 1, and so the BIMS summary score is an 11 here. Is that your experience for those who did scenario 2? Yes, okay, great. And then script number 3. So we have here that the patient scores, so we have repetition of 3 words, we had a 0, the year was 0, month was 0, day was 0. At that point, we were able to, I think there was nonsensical answers, if I remember correctly, for this particular scenario. And so, yes, these were nonsensical. The person was not relating back to anything related to the questions. So what we would do is after C0300C, the day, we dashed 400A, B, and C. We coded this as a 99. And once we code this summary score as a 99, it's an incomplete BIMS. So then we need to move on to the staff assessment. And is that what you got when you practiced? Yes, I'm getting some nods of yes. Okay, great. These are the type scenarios, especially like when you're practicing with your staff, have them practice, use scenarios where they get a 00, they get a 99. So understanding when to stop the interview, to go to a 99 and complete the staff assessment is important. Having them understand that a 00 is a valid BIMS assessment score and that they don't need to go on and do the staff assessment. These are the kind of some important lessons for you to take back and work with your facility staff with. All right, so BIMS video for, hopefully, all of this information is going to be posted. I think they were able to capture it live here, even though you weren't able to see it on streaming video, we still have it. So when all these materials get posted, the videos will be posted, you can see everything that happened, and we did a live demo. But in between, if you want to say, well, this is really important, I want to understand how the interview is done, you can go to the attached YouTube channel and watch a sampling of how the interview can be conducted. And again, you can use that for staff training. All right, so we're going to move on to C0600, should the staff assessment for mental status be conducted. And so the rationale for here, we can, mental status, as we've talked about, can vary among persons unable to communicate and who do not complete the interview. You must observe the behavior of the patient unable to complete the BIMS. So this is your interpretation about what the patient can and can't do versus what we're going to get with the BIMS when they actually give us information. If we are incorrect in our diagnosis or we have missed impairments, may prevent appropriate communication, activities, and therapies. Abrupt changes in cognitive status often signal an underlying potentially life-threatening illness or a changing condition. So often we can pick up maybe some early signs of a delirium. And I think when you do the BIMS, you certainly could try to pick that up. So it's very important to try to do the BIMS, but if not, we're going to do this staff assessment. So we start off by reviewing the C0500 summary score, determine if the BIMS was completed successfully or not, conduct the staff assessment only if there's a 99 there, and the score of 99 indicates that the BIMS was not complete. So the first question here is on C0600, code no, interview complete, summary score equals 00 to 55. So this is saying, should we complete the staff assessment? So you're scoring a 0. No, I don't need to do the staff assessment because I already did the BIMS and the BIMS was had a valid score. Or yes, I need to complete the staff assessment because I was unable to complete the BIMS. I have a 99. So then I go ahead. If I'm scoring, the BIMS was a 99, which means I did not, or the patient was unable to complete the BIMS, I now need to do some sort of assessment, and that's going to be the staff assessment. And so if the patient scored 00 on C0500, the BIMS summary score, what this is saying, then the C0900, the staff assessment should not be completed. So again, remember 00 on the BIMS is a valid score. You don't need to do the staff assessment. That's just reiterating that point. All right, C0900, memory recall ability. And observed memory recall problems may indicate cognitive impairment, need for additional support, a delirium. if represents a change from the patient's baseline. Steps for the assessment, you can either ask the patient about some of the items in C0900 or certainly observe the patient. You can see if they're able to indicate the season. Is it fall, winter, spring, or summer? What's the name of this place? Ask the patient to show you the way to his or her room, or observe, can they find their room? Or do you constantly have to go and, they're trying to go into every room and they can't figure out where their room is? And just how do they navigate their environment? For patients with limited communication skills, ask direct care staff across all shifts and family or significant others about their recall ability. You may want to review the medical records. You may want to look at other staff notes. And then certainly you want to do an observation of the patient. And so some of the questions that we have here, let me just jump forward. So for each item, these are the coding instructions for C0900. Check each item of the patient that they recall. Check Z, as in zebra, if none of the above were able to be recalled. So for A, what is the current season? If they're able to identify the current season correctly, referring to the weather for the time of year, legal holidays, religious celebrations, are able to kind of give you a sense about what the season is. Location of the room, again, we talked a little bit about this, so you're either able to tell you what their room number is, they're able to show you to their room, or you're able to observe that they can consistently find their room, they know which hallway to go down, or they totally, constantly looking for their room and they can't find it. Staff names and faces. So names can be hard, especially, if it's in the first couple of days, but they seem to kind of, they acknowledge you. So, this has come up in training before. They call you Mary, and your name is Ann. But they consistently call you Mary. And not every nurse is Mary, but you're Mary. For whatever reason, Mary has stuck in their head. They at least know that you're the nurse and their name for you is Mary. So it doesn't need to be that, you correct them every time and your name is Ann. For whatever reason, you remind them of a Mary. And so that's okay. They understand, they know your face, they recognize you. Kind of like what Karen did here, but in the interview, she said, oh, yeah, I've seen you on the unit, you're one of the nurses, So she recognized me as being one of the staff members, and so I was familiar to her. That he or she is in a hospital or hospital unit, and some of the frequently asked questions comes up, well, what if they say, they know they're in a hospital, but they say the wrong hospital, or the name is incorrect? Well, the fact they know they're in a hospital, they don't know that they're, in the Marriott in downtown Chicago, or something like that. Do you know what I mean? They know that they're in a hospital. They don't need to get the name exactly correctly, especially if they've moved around a couple of places. But the fact that they know where they are, that they're not in their home, that they're not at their daughter's place, if they were in maybe an assisted living or another communal type living, and now they're in your IRF, they should be able to say that they're in that hospital type setting. Or scoring a Z, none of the above. I think we beat this dead horse. Complete the BIMS on all patients. If you can, attempt it. Follow the instructions, we already did that, and then only complete if you absolutely can't do anything else. You have to use the staff assessment. It is the assessment of last resort. The majority of the time, you are somehow going to be able to complete the BIMS. So in your organization, as you start to use these tools, Karen talked early on about in her facility, they've been doing a lot of training, and they're going to start completing the assessments, and then they're going to start looking at them and hopefully give feedback to staff and look for additional opportunities to educate. So if, for example, in this section, they found 50% of the time that staff are going right to the staff assessment, that would probably be an opportunity to stop and go back and really work with the staff and say, there probably was much greater opportunity to complete the BIMS, and staff were just jumping right to the staff assessment. So I think you have that opportunity as you're practicing and using these tools. Educate, 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 practice, 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 especially around things like this where it's very prescriptive in how you complete the assessment. Have staff actually do the interviews, practice with each other. Once they become comfortable, then have them practice with some of your patients. Practice using a variety of coding scenarios with staff, especially those ones, the 99s and the 00s. Have a situation, maybe practice where you would think someone has hearing aids. They say they have their hearing aids in, yet the hearing aid batteries are dead. Something like that. So have them kind of work through what you think are going to be common scenarios that they're going to run into. Review and update processes and procedures that may need to change in preparation for implementation. Think about, Karen gave the example this morning, in her organization, I think they determined for this particular section they were going to have speech therapy do the assessment. She's nodding yes, so I was correct in remembering that. So in her scenario, I guess if they have enough speech therapists, that's who they're going to train to do this section, because that's who's going to do the assessment in their facility. So you're not training every staff member, you're training a small group. Now, if you're saying, well, no, we really want nursing to do it, well, then you have to make sure all of your nursing staff who could potentially be doing an admission assessment is completing it. If we're saying, well, no, we kind of have an assessment team, and it consists of these 15 members, okay, then the 15 members need to be trained. So just determine what it is in your organization, think it through, what makes sense, where's your admission volume, what times of the day, what days of the week, who's normally on, what's your, who has capacity, whatever it is and what makes sense. Determine that, work through it, and then make sure that you're training and deeming the people who are doing these assessments that they're competent to do them. Evaluate your current documentation to ensure terminology aligns with the items in the IRF-PI version 1.4. So this in general is a good idea. We talked about, or Karen talked about early on, it's in your folders, and for those watching in the streaming video, there's a document called the Action Plan. That document, if you can take it out, either have it electronically on your computer and or print it out, and it is in our folders here. Just keep that open and to the side. It's a good place to jot down notes. Oh, that was a good idea. This came up at my table, something I need to look at when I go back to my organization. Or you may have come up with a really good idea I think I want to implement, and here's some of the key strategies that were talked about at our table. Put those down. That's going to help you to remember it, because you go back and you say, there was something I was trying to remember, a good suggestion that someone had. We'll write it down on your action plan. Then when you go back and say, oh, done, 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 and now you're ready to move forward for October 1st, 2016. All right. So we have a couple of minutes left. I think about 5 minutes if my watch is correct between me and a break, right? Okay. So I'd like to open it up if there's any questions. If there are any questions, if you can go to the mics, because we have the streaming video so that everyone can hear. Great. Okay, we have a question over here.
My name is Stacy McClure. Can you hear me?
Is it recording okay? Can you hear? Yes, go ahead.
Okay. My name is Stacy McClure. I'm from the University of Utah Hospital.
Uh-huh.
And I was wondering, for the cognitive, we get an admission codes, and then for discharge, are we getting a usual score? Can we just get one assessment on that?
So this is just done on admission. It's not done on discharge.
Okay.
Right, so it's
Thank you.
just an admission assessment.
Hi, my name is Audra Brooks. I'm from Orlando Health Rehab Institute. And our question is, it has that it's a 3-day assessment. Is this done once during the 3 days? Is it done multiple times during the 3 days? And are you looking for
Most
a low
usual,
score?
yeah.
Yeah.
Great question. I'm sorry I didn't address that, and I should have. The intent for this is for it to be done once, as close to admission as possible. So, but if someone comes at like 3 o'clock, is transferred to you, and they're exhausted and they can't even like hold their head up and whatever, you may want to wait till the next day to do that assessment. It's not meant to do multiple times and then come up with most usual. It's meant to be done once. but a good question. Yes?
Hi, my name is Judy Dunkowski. If you have somebody who has expressive aphasia, how do you conduct this? I mean, you can't show them pictures and things like that, so how do you get answers?
So great question. You attempt the BIMS, and if you're unable to complete the assessment because they're just unable to use any technique by writing or whatever, then you would have to code that as a 99 and then go on and do the staff assessment.
So for the staff assessments, can they then use pictures and
Well,
resources like that?
Yeah, no, you could, and then you might just have to do observation also.
Okay.
Do they seem to be able to,
But for
find their
season-
room and stuff? They seem like they smile and are relaxed. They seem to recognize you on some level. They may not be able to communicate the name. You may not be able, it may be hard for you to assess whether they can know the season or not.
Right.
That may be something that you can't assess.
Okay.
It's an imperfect, the staff assessment piece is an imperfect tool. It's the best that we have, though, to do some level of
Okay,
assessment.
so just what you can observe is what you could check.
Observe or somehow, if the person can communicate in any way with you.
Okay.
Yeah,
thank you.
try to do that. We have any other questions? Okay, we encourage those in the audience here. You have cards to write questions. We have the database to enter questions. And Mark, do you want to go through that again since we have people on streaming? Or no, am I putting you on the spot for that?
Thank you, Ann. We had planned on showing the slide with the link to submit questions online. So if you're viewing this on the web, or if you're in the room, you may submit questions online through the link that will be up in just a second.